So we're looking at a type of bleeding that could actually occur in the brain. So this one is more of like in the skull. Do you understand? But in the skull, what we have is the brain there. Do you understand? So any bleeding around this region is what we call the intracranial hemorrhage. Intracranial hemorrhage. So there's a bleeding right into this place, and that's just what we call the intracranial hemorrhage. So you can see it, and you can get to see that one mostly is imaging that we use to diagnose these issues. So for intracranial hemorrhage, for the types, we have things like the epidural. You can see this is the epidural hemorrhage, the first one there. Okay, let's introduce. So it just refers to bleeding within the skull, and it occurs in various compartments of the brain. It's a neurological emergency with high morbidity and high mortality. That means patients rarely escape this. Once you have bleeding in the brain, usually leads to what? Death scenarios, So it often resulting from trauma, could be hypertension, could be vascular malformations, could be coagulopathies, So types, we have the epidural. Okay, we have the subdural. Don't know if I have the picture of subdural. Yeah, epidural, subdural. You can get to see them. Then we have the subarachnoid. Of course, that's to be inside the subarachnoid space. Then intracerebral hemorrhage. Then intraventricular, where there is bleeding into the ventricles. All right. So here you could actually get to focus on the location, then focus on common things that cause these issues. All right. So you can pause and get to observe this table as we are looking at it. All right. So this is another one. Intraparenchymal, intraventricular, subarachnoid, subdural, epidural. This one is different imagings. Do you understand? Please pause and observe these beautiful pictures, right? So pathophysiological mechanisms, hypertensive vasculopathy. So it's usually caused by what? Like the blood flow in your blood vessels is kind of like too toxic for the blood vessel to withstand it, leading to like bursting of the blood vessel. Then cerebral amyloid angiopathy, then trauma. Sometimes it's like direct injuries to the blood vessels is what is actually responsible for causing these issues, Then vascular malformations, then sometimes it's just that your blood, things are not actually cool and all of that. Okay. How your blood is clotting, how your blood is being in liquid is not being stable, So that's what is just causing you to just bleed spontaneously, So clinical consequence: compression of adjacent brain tissues. Of course, that should cause headache, raised intracranial pressures, neurological deficit, depending on which part of the brain is affected. All right. They could also lead to what? Accumulation of fluid. All right. That's hydrocephalus.